Hello everyone, my name is Jacob Bryant and this presentation is talking about basic CPR. So first, I'm just going to let you guys know a little bit about me. I'm currently a paramedic for North State Medical Transport. I'm a baby medic, if that's what you want to call it. I just got my paramedic last month at 12/24, but I have been an EMT for about 2.5 years. I work 911 and IFT. So this presentation is directed towards more of the non-healthcare provider side of the world. This is for people who are not in EMS or might be just getting their foot in the door, taking their EMT basic or taking just their initial BLS CPR. So the question comes up, why does it apply to me? A big point of it is you never know when someone might go into cardiac arrest, whether that's a family member, friend, or just a neighbor down the street. Something could happen and you're the first person there. It's important to be able to start compressions as soon as possible because, as I said here, it helps survival rates in cardiac arrest patients when compressions are done immediately. The patient starts having a heartbeat. Another big thing is that some areas might be having long drive times for EMS. I know a good example of that is right now in the mountains, at least past couple months, they've been having difficulty getting EMS trucks up to the Girton and Batcave area just due to all the roads that are destroyed from the hurricane. When we were talking about CPR, we were talking about cardiopulmonary resuscitation. The three main points of that is compressions, ventilation, and medication defibrillation. The most beneficial intervention for a person in cardiac arrest is compressions as soon as possible. The AHA has found that it can double or triple survival rates. This is because it maintains perfusion to the body and the brain. That 5-10 minutes that you're doing compressions before EMS gets there, it helps keeps the blood flowing through the body and also can help keeping the brain and the heart oxygenated. So this presentation will help prepare you for pre-hospital or pre-EMS CPR. So we're going to go ahead and just break it down step by step. So initially, what you want to do is you want to check responsiveness. It could be an overdose or intoxication. It could be hypoglycemia, medical emergency such as a stroke. It could be sleeping. So first thing you want to do is you want to be like, hey, can you hear me? Are you okay? You want to go ahead and call 911 because whether it's a cardiac arrest or not, the patient is in somewhat critical condition as long as they're not just sleeping. And they probably will not hurt from having EMS check them out, even if they do wake up later on. After you check for responsiveness, you then want to check for a pulse on the carotid. You can also check on the femoral artery, and you want to look for chest rise and fall for breathing. So see it, if they're breathing through their mouth, hearing any sounds like that, even if it is somewhat obstructed, you just want to see if there's any type of breathing going on. If there's no pulse, no breathing at all, you want to go ahead and begin CPR. So the first thing you want to start doing in CPR is the compressions. You want to do the compressions by interlocking your fingers like this. You don't want to extend your arms all the way to the locked out, but have them just about right there. You want to start doing compressions right at the xiphoid process, which is usually in the middle of the chest between the two nipples. You want to go about 2 inches deep. Do it about 120 beats per minute, and you do want to switch compressors every 2 minutes. Even if you are the most athletic person alive with the best cardio in the world, you want to make sure you're giving adequate compressions to the patient as much as possible. Obviously, if you're doing this in the pre-EMS setting where you're just a citizen, you might not get that luxury. So, you might just have to keep on doing compressions the whole time. So your next step is you want someone to go ahead and try to get an AED. An AED is an automated external defibrillator. It is used to analyze the rhythm the patient's in and shock them if it's needed. If you're alone, you probably want to grab the AED after 2 rounds of CPR if you know where it is. You don't want to have a guess. If you know, go get it. If you don't even try to get it because it's not worth the amount of time you'd not be doing compressions on the patient, which can lead to the inadequate perfusion to the body and the brain. If you do get the AED, you want to go ahead and apply it to the area of the body the pads recommend. Most say the anterior or the anterior lateral. For pediatric, they usually say the anterior posterior. And even for some adult, they'll say do the anterior posterior, which is front of the chest, back of the chest. You also want to make sure the skin and pads are connected appropriately. There might be some hair that you might have to shave off. There might be some sweat that you might want to have to dry off. But you want to make sure there is a pretty good connection between that pad and the skin so it's able to shock effectively. The next part of CPR you're going to be working on is making sure that you gain ventilation for the patient. Every 30 compressions, you want to do 2 rescue breaths. You can use either the BVM or rescue mask, whichever you have available. The BVM, you want to do just a medium squeeze on the BVM. You don't want to squeeze it all the way, squeeze it a little bit. You want to get a good amount of air in, but not too much where you have the potential of popping a lung. If you have the rescue mask, you just want to put the mask on the patient's face, and whenever you do the 30 compressions, go ahead and stop and give the 2 rescue breaths. And then you also just want to make sure you gain the equal chest rise and fall upon ventilation, whether that's you using the BVM or you're using the rescue mask. If you don't have the equal chest and rise and fall, this might lead you to believe that the patient might have a collapsed lung, or like I said, you might have done the BVM too much and it also caused the collapsed lung. So we talked about doing the compressions, we talked about ventilations, and we talked about applying the AED. The next part of CPR is doing the pulse checks. So every 2 minutes, you want to stop compressions, allow the AED to analyze the rhythm to see if it needs a shock or not. During that time, you also want to put your hand on either the femoral or carotid artery to see if you feel a pulse. If the AED does say shock advised, you want to get off of the patient, don't touch them at all, allow the AED to deliver the electrical shock. If the AED says the shock is not advised, you'll go ahead and go right back to doing compressions. Also at this time, if you do have the resources, you want to go ahead and try to swap the compressors if available. So next, you might want to try to look into the whys. You want to try to identify any obvious causes of the cardiac arrest, whether that's a needle. If there's a needle nearby, it might lead you to believe maybe the patient had an overdose. They might have nearby medication or equipment. You have a patient that's taking nitroglycerin, aspirin, some cardiac medication. It might lead you to believe something cardiac related caused the heart attack or the cardiac arrest. And it could also be trauma. Obviously, if you see someone in cardiac arrest and they're right next to a car that was in a car accident, that might lead you to believe that this was due to trauma. It could help you tell a little bit about the patient, because during cardiac arrest, you're not able to do a assessment at all with the patient because this patient is not breathing. You're able to do with what you see around them and obviously how they're reacting to the interventions. So if you have the time, just try to look at the scene a little bit, look at the patient, if there is extra people around, maybe see if they're able to see any clues that might lead to the cause or finding the cause of the patient's cardiac arrest. And then finally, you want to prepare for EMS arrival. One big thing of it is you want to clear as much area as possible for EMS. This is because EMS has a lot of personnel. They'll have at least 2 to 4 EMS providers, and you'll have a crew of fighters. You'll also have an EMS supervisor, and that's usually the bare minimum for cardiac arrest. So you're going to have a bunch of people coming in there, usually at once or within the same little time period. They also will have a bunch of equipment because they have to take care of the ventilations. They have to start beginning to give the medications, which is the one thing that we do not give in the pre-EMS CPR that we were talking about. And then also you need the room for extrication. If they are able to get a pulse back on the patient, they want to be able to get up and go after the 10-minute ROSC period is over. After that, you want to start thinking about the report you're going to give the EMS providers. This report will allow EMS providers to get a little bit more of an idea of what has been going on since the patient has gone down and you've done your pre-EMS CPR. So the big things to state is how long the patient has been down, number of shocks delivered by the AED, and the scene surroundings, especially if the patient was moved. As we were saying before, the stuff around the scene might help the providers and you lead to a answer why this patient went into cardiac arrest. And then finally, you just want to let them know your credential, whether you're an EMT, whether you have your CPR, whether you don't have anything. Depending on the agency, depending on the resources available for an agency, they might take your help. They might say, hey, you did good compressions. We're going to keep you on, have you keep on doing compressions. Sometimes they're just like, we're fine. At that point, you just get out of the way. But it definitely does not hurt to ask, and you were already helping them while they were getting there. I'm sure some people won't mind if you keep on doing it. So that was pretty much the gist of what to do if a cardiac arrest does present near you. We're going to just go over the key points again. First thing you want to do is check for responsiveness. Make sure the patient isn't just sleeping or is hypoglycemic. Make sure there isn't something else going on, or they could just be too drunk. When alcohol intoxication happens, some people, they go into this really deep slumber, sometimes almost a coma. After you check for responsiveness, if you don't get a response after that, you then want to check the pulse for, a heartbeat, along with checking to see if the patient is breathing. After that, if they're not breathing, they don't have a pulse, you want to go ahead and begin CPR. You want to go ahead and start doing compressions on the chest around the xiphoid process, or in between the nipples in the middle of the chest. You want to interlock your fingers like this and go into the chest about 120 beats per minute. You want to try to get a BVM or a rescue mask and start doing ventilations every 30 beats. You want to do 2 rescue breaths every 30 compressions. At that point, you want to have someone get an AED, call 911 so EMS can begin transporting. After you got an AED and had someone call 911 for EMS to start transporting to where you're at, you're going to go ahead and apply the AED depending on what the pads say. You want to either do that anterior posterior, which is front of the chest or back of the chest, or do it anterior lateral, which is usually right here and then below the left part of your chest, near your ribs. At that point, then you want to do the pulse and shock check every 2 minutes with the AED on, allow it to analyze the rhythm to see if the shock is advised. You also want to go ahead and swap compressors if you do have another person that can do compressions as well. You also want to go ahead and just start thinking of the report you're going to give to EMS. You want to let them know how long the patient has been down, how many times they've been shocked, and anything else that could help the providers kind of get a story of what caused the patient to go into cardiac arrest. So this is the end of the presentation. Thank you guys so much for listening and watching this presentation. Now we're going to go ahead and show how to actually do it. I'm going to show a kind of simulation of what to do if you are a non-healthcare provider and you were to find someone who might be in a cardiac arrest. Please forgive the lack of true training equipment. I had to get a little bit creative, and here we go. Hello everyone, my name's Jacob Bryant. This is a presentation of what to do if you're not in an ambulance and you start to see someone that might be in cardiac arrest. There's going to be the step-by-step process of how to handle this situation. So first off, you see someone like this, they're not talking to you, they look like they might be out of it. First thing you want to do is you want to try to check for responsiveness. Hey man, can you hear me? Can you hear me? At that point, if they don't respond to you trying to touch them, scream at them, is when you then check for a pulse. 2 great places to check for the pulse is either the femoral artery area right here, or checking up on the carotid artery right below the neck, near the jaw. Along with checking for a pulse, you also want to check for chest rise and fall. If a patient is in true cardiac arrest, they will not have a pulse, along with them also not having any breathing or chest rise and fall. At this point, you want to go ahead and move the patient onto the ground. Obviously here, we'd have firefighters, or you do it yourself, and you'd move them to the ground. So after you move them to the ground, you try to have someone go and call 911 and get an AED. For you though, you want to start doing compressions. You want to do compressions on the xiphoid process, which should be in between the 2 nipples right here. You want to interlock your fingers and you want to push down on the chest. When you do it, you want to push on the chest and you want to do it 120 beats per minute. Just like this. Depending on what you have around, you'd want to either use a rescue mask or a BVM, a bag valve mask. You'd want to do 30 compressions, doing 120 compressions per minute rate. After you do 30, you want to stop and do 2 breaths, either using the rescue mask in your mouth or using the BVM. And you want to do a medium squeeze on that BVM. After this point, you want to go ahead and put the AED on. Depending on what AED you have, you either want to put it right here and right here on the anterior lateral, or you might want to do it anterior posterior. Pediatric patients are also more recommended to do the anterior posterior. So at this point, you should be doing the 120 compressions per minute. Every 30 compressions, you want to do 2 rescue breaths. You want to have the AED attached, and you want to have help on the way. After you do this, every 2 minutes, you want to stop compressions. You want to use the AED you have attached and check for a pulse. You're going to check for a pulse the same area you checked before, whether that's the femoral artery or the carotid artery. While you do that, the AED will analyze the rhythm and see if it's a shockable rhythm or not. If it is, you will clear off the patient and let the AED shock. After you do that, if it says either shock advised, clear, it says clear shock, you get off, you resume compressions. If it says shock is not advised, you go back to doing compressions. After that, you just keep on doing compressions and ventilations. You want to keep the area clear, and you want to start to think about the report you're going to give EMS when they come. When EMS comes, you want to tell them how many times the patient has been shocked, how long the patient has been down, and possibly anything in the area that might lead to the patient going to cardiac arrest. For example, if the patient had a heroin needle right next to them, that might lead to them going to cardiac arrest due to an overdose. If someone was in a car accident or they got attacked, a bloody area where they lost a lot of blood that you moved them from might show that they went to cardiac arrest due to traumatic injury. After that, you want to tell the EMS providers what your credential is. They might need your help. They might want you to keep on doing compressions. If not, you just give them space and let them do what they have to do. Thank you guys so much for watching this video, and y'all have a good day.